Extubation is a medical procedure that involves the removal of an artificial airway from the trachea. We created this video to cover the medical definition and provide a brief overview of this topic. So, if you're ready, let's get into it. Airway management is the process of maintaining ventilation so that gas exchange can occur. This allows a patient to take in oxygen while removing carbon dioxide. This is important because we need to keep a patient's upper airway free and clear so that air can flow into and out of the lungs. And one very important aspect of airway management is extubation. As previously mentioned, extubation refers to the process of removing an artificial airway from the patient's trachea. An artificial airway is a tube that is inserted into the trachea in order to maintain breathing and ventilation. This is necessary when a patient is unable to maintain their own airway or if they are at risk of aspiration. In this case, an artificial airway is used to establish a link between the patient and the mechanical ventilator. There are two primary types of artificial airways that can be used for intubation: endotracheal tubes and tracheostomy tubes. Each type has different uses and advantages. However, in order to function properly, they must be inserted and maintained correctly, which is the job of the respiratory therapist. But with that all said, extubation cannot occur without intubation happening first. Intubation is the process of inserting a tube into the trachea in order to establish an airway and facilitate breathing support via mechanical ventilation. This creates a link between the patient and the ventilator so that gas exchange can occur. With that said, intubation and mechanical ventilation are only temporary for most patients. Therefore, at some point, the artificial airway must be removed, which is a procedure known as extubation. The decision to extubate a patient is based on many factors, including the following: the patient's ability to protect their airway, adequate respiratory function, ability to manage secretions, adequate oxygenation, stable hemodynamic status, and their ability to cooperate with the medical team. The respiratory therapist or physician will generally perform the extubation procedure. This involves oxygenating the patient, deflating the cuff, removing the tube, suctioning secretions, and assessing and closely monitoring the patient. If you enjoyed this brief overview, there are some other videos popping up on your screen right about now that I think you'll find helpful. And if you want to support the channel, be sure to like and subscribe. I would greatly appreciate it. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day, and as always, breathe easy, my friend.